Good evening, good afternoon, and good morning. This is the 1774th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. KANCHAN UPRETI. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathy lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money. You can share it with your friends and allow homeopathic lovers too. The purpose of this forum is to take homeopathy to every home around the world. And we have participants from 65 countries already presented papers in different subjects, and most of them are eminent personalities from international side. And we are very happy to say that we have crossed the 7,000 subscribers in our YouTube channel, IFPH Homeopathy. Let me come to today's guest. As you all know, today our guest is Dr. KANCHAN UPRETI. She is a gold medalist. She's a gold medalist and from Nehru Homeopathic Medical College and Hospital, New Delhi. And he's a homeopathic physician, researcher, international speaker, and author. She has some professional membership also, member at European Sleep Research Society, member German Sleep Research Society, member Liga Medicorum Homeopathic International, that is LMHI. And Dr. will be discussing about homeopathic management of sleep disorders and associated conditions in children and adolescents. As you all know that this is a very, very important subject to be discussed, and we as homeopathic doctors can do a lot of good things for sleep management. And let us proudly welcome the guest of the day, Dr. KANCHAN UPRETI. Welcome, Doctor.
Dr. Kanchan, I see that you have joined by the two names.
Yes. Yes, sir. Yes, sir.
He has joined by through the two names. Which
Yes,
one is
sir.
effective?
Yes, sir.
I have made in one. I have made her the co-host. Dr. Kanchan, are you able to listen to me?
Am I audible?
Yes, the echo is coming from your side, so that you can mute the one of your set.
And you let me know which is effective for you.
Please raise the others.
Can you only Kanchan UPRETI?
Yes. Doctor, the echo is coming.
Am I audible, sir?
Yes, audible, but the echo is coming. So you need to unmute one of your set. Otherwise, echo will come.
One set you have to, yeah.
Please make.
Is it fine now?
Somewhat good. Somewhat good.
Okay. Okay. Thank you. Thank you, Dr. Dhanesh, for such a warm welcome. And I'm really honored to be here and presenting my insights on International Forum for Promoting Homeopathy. It's really an honor for me to share my insights with all the experts.
Just to interrupt you, Kanchan.
Yes, sir.
You are talking through the link that you are not made the co-host. You want to make the co-host through this link, or which one do you want to continue?
Sir, now she's talking from. We can continue co-host in both sessions because she might have. Okay, sir. That is.
Okay. Okay.
Now we can make. Okay.
I think it is okay for her, na?
Okay. Okay, now, sir. Okay.
And Dr. Dhanesh, now I am making you the host now.
Okay, sir. Okay, sir.
Okay. So today, I will be discussing about homeopathic treatment for sleep disorders and related conditions in children and adolescents. It is combined from a critical narrative review from many research publications as well as some clinical studies as well. So what I have seen in my practice as well as what I have seen after reviewing all the papers and interacting with a lot of researchers and doctors outside India as well, that there is a problem that in children, such conditions related to sleep disorders are often neglected. They are often overlooked. So let's begin with this. When we talk about the pediatric sleep disorders, these disorders are increasingly prevalent, and these conditions includes insomnia, which is very common in adolescents, children, and adults as well. And next is bruxism, that is teeth grinding, and it is one of the most common causes of children facing sleep disorder. So this is one of the most common disorder. Next is anxiety-related sleep disturbances, and other is obstructive sleep apnea. So these four, I have gone through all the papers and I've seen that these four are the main conditions which are obscuring the path of child to grow properly and in a fashion, in a manner in which the child can have a proper sleep. So when we talk about bruxism, it is a very common disorder in children obstructing their sleep. Good sleep. So when we talk about bruxism, it is not single, but it is correlated with many other conditions as well, like obstructive sleep apnea, anxiety-related sleep disturbances. These both are interrelated with bruxism. Now, how? So in traditional belief, every doctor and people usually used to think that intestinal worms are one of the causes of bruxism. But in modern medicine and in modern view, it is seen that not only intestinal worms, but there are some other conditions as well. And the other conditions are like anxiety issues. Anxiety issues are related to the school-going children, some family issues. These are the issues which are related to the disturbances in sleep of a child, and these leads to anxiety. The other one is obstructive sleep apnea. So when we talk about sleep apnea, we know that there are so many causes. It's not just a single one. They can be anatomical, some medical problem, or any other. So these include the narrow airway, and very common is enlarged adenoids, tonsils, low birth weight, mouth breathing habits. So these are some of the habits or some of the conditions which leads to OSA. And then OSA leads to the bruxism. That is what happens. Treating OSA often reduces bruxism because kids with obstructive sleep apnea, they try to grind their teeth just as a reflex to make a way through their narrow airway to breathe. So this is a reflex to open their narrow airway so that they can breathe easily. The other disorders which we can talk are insomnia. That is also related to all these conditions which I have earlier described. So these disorders can have wide range effects on children, impacting their physical growth and development, their emotional well-being and behavior, cognitive function, academic performance, and of course, their overall quality of the life is impacted. One more thing I would like to mention here, that not just these disorders, but one more thing, that is melatonin. Melatonin is something we know that it is a hormone which is secreted from the pineal gland. So melatonin has a great effect on the sleep disorders of a child. What it does, we all know that its levels rise towards the evening till early morning. And from morning till evening, its levels are not so much to cause, they are just somewhat like not causing sleep or drowsiness, but they cause the symptoms of alertness. So it does not put a patient or a person into sleep like a sedative, but it alarms a person or signals that it's time to sleep. So when we talk about melatonin, we know that in a newborn, it is not secreted so early. It is secreted after 3 months. So we have to, the child has to be given melatonin externally. Now, when we talk about externally, how externally? That is through the breast milk of mother. So when the breast milk is given, I have through my all the researches, going through all the journals, research papers, discussion with doctors, even in my medical conferences also I have discussed with many doctors this particular thing, because this was a very important topic over my last medical conference, that melatonin breast milk given to a child at night is more effective than at early morning or day, whatever we can say. So what is the reason behind this? It was the reason that when the mother breastfed the child during night, it is more effective in preventing their anxiety, preventing their child grinding, because this will lead to a better sleep than breastfeeding the child in the morning, because it follows or it is correlated with the circadian rhythm of the mother. Definitely, the melatonin doesn't work like it has to do as a normal hormone. So when it is given through the breastfed milk, when the mother breastfed the child, then it is more effective during the night. So I've seen that some of the doctors claimed that during their clinical practice, when they ask the mother to breastfeed the child during the night and then see the effects of the sleep, how the sleep disorders are getting better or how the sleep of the child is getting better, then they said that it's really getting better in a manner that the child has started sleeping for long and it with a sound sleep and without teeth grinding as well. So this is a great observation, I would say. Now, the common pediatrical sleep problems: insomnia, which is difficulty falling asleep, frequent night waking; bruxism, that is grinding teeth at night, jaw pain; OSA, we know, obstructive sleep apnea, that is snoring due to many other reasons; breathing pauses, restless sleeps; anxiety-related disorders, nightmares. So as I said, bruxism is not just because of intestinal worms as per the traditional belief, but it is also due to other reasons as well. So night terrors is one of the reasons why the child are going or they are facing bruxism as a severe condition, which is obstructing their sleep. Fear of dark, crying in sleep. So crying in sleep is related to the fear of dark and nightmares. Night terror, sleepwalking, screaming, walking during the sleep. Teething related is definitely irritability. This could be due to intestinal worms as well. Pinworms, sleeplessness during dentition. These all are correlated to each other. So definitely in the very first aphorism of Organon of Medicine, it is clearly mentioned that the physician's highest and only mission is to restore the sick to health, to cure, as it is termed. So truly, regardless of the system of medicine, be it any allopathy, homeopathy, Ayurveda, or anything, the core mission remains the same. It all depends on the physician. Now, homeopathy, a holistic approach that we all know about this, that like cures like. So it's not that while treating the disease in a child or in adolescent, we will directly look to the therapeutics. That if there is insomnia, we can prescribe passiflora, we can prescribe phytoleca or any other remedy. No, it's all about individualization. The core principle remains the same. Holistic approach remains same. Individualization, holistic approach, symptom similarity, this all remains same, and the patient is approached, or the conditions of the child, the problems of the child are approached accordingly. Now, miasms in homeopathy. This miasmic condition, this really means a lot when it comes to a child. Why? Because it is not just related to a pediatrical problem, it is related to the mother as well. So while taking the case, we have to take the case of the mother also very carefully. So we get to know a lot about how the mother is breastfeeding the child, what are the circumstances she has gone through during her pregnancy, from her start to the last, all the months of the pregnancy, what she has gone through. So this is very important. And if the child is a premature baby or post-term baby, preterm baby, we have to look to all the factors. And these factors are really very important because these factors impact the mother as well as the child post-birth. Now, the main focus while making this critical narrative review was to focus on sleep bruxism, insomnia, anxiety-related disturbances, and these studies comparing homeopathy with pharmacological treatments. So, a comprehensive research was conducted across several relevant databases, and all these were Scopus indexed journal articles. I have gone through 15 randomized controlled trials, 8 systematic reviews, 20 review articles, 22 case reports, and some case reports of my own clinic as well, and case series from 2024 narrative review, which I really found very important. So 15 pediatric OPD cases with sleep disorders received individualized homeopathic treatment with outcomes monitored over 15 days. So these cases were from my own clinic. The studies on homeopathy for sleep disorders related to ATH were included with evidence quality assessed based on methodology and adherence to evidence-based principles. So not only the 4 conditions I've mentioned, but we know that sleep disorder could be due to overactivity, that is ADHD also, which is a very important factor, and it is also related to melatonin as well. So ADHD hyperactivity is seen in some children where the melatonin content or the melatonin production is very less or very poor. So the results and discussions include, throughout my research, I have seen, after reviewing all the research papers and collecting the data, I have reviewed that homeopathic treatment significantly reduced sleep bruxism, improving the sleep quality. So bruxism was one of the factor which was a hindrance to the sleep, good sleep of the child, and this was one of the outcome, I would say, of many preceding conditions. This was one of the outcome of obstructive sleep apnea, insomnia, anxiety-related disorders. So these were the conditions which were the causes, and bruxism ultimately was the outcome which presented as a symptom in children, so that we can understand that, yes, the child is going through a disturbed sleep. So during my research, I found that treatment with Melissa officinalis and Phytoleca decandra, these 2 medicines helped manage bruxism, suggesting their potential benefits. So here is some important thing I want to mention, that when I have seen that when Melissa officinalis was given alone to the children, it has shown a great impact, a great result it has given. But when it was given with Phytoleca decandra, it was giving almost the same result. There was not so much difference when it was combined with Phytoleca. But when we talk about Phytoleca and Melissa differently, individually, when we talk about the both remedies, then Melissa has a more good result than Phytoleca. So when they were combined, they have some average result that was almost matching the results of Melissa alone. So there was not so much good results from Phytoleca, but comparative to other medicines, as per my study of the researchers I have seen, Melissa and Phytoleca both were effective. Now, I would like to say that homeopathy presents a promising alternative for managing pediatric sleep disorders, particularly bruxism, by individualized care and by addressing the underlying causes. But it is not only effective, but I would say it needs more and more clinical trials as well. To be very honest and to be very practical, so that there should be a more renowned growth of homeopathy, I would want that more clinical trials should be done and more RCTs should be done, so that we get the more and more results that which medicines are more effective in treating the sleep-related disorders in adolescents and children. Now, here are some remedies which are very effective in insomnia in the children. And these remedies are also the remedies which we have seen in adults also and in older age people also. So these are Passiflora incarnata. When there is, obviously, one thing I would like to say, that definitely we will look over the whole case. We will see the individualized medicine. We will do the individualization of the case, but it's not limited to a particular symptom of a patient. It is related to other symptoms as well. But when we sort out the remedies and we see the therapeutic effect of the remedies, then we say that yes, these are the remedies and these are the indications which are correlated, and these indications should be more marked in a patient. And these are the indications of the particular remedy in a prominent way. So the indications for Passiflora are restlessness, nervous exhaustion, student insomnia. When we talk about coffea cruda, the patient is overexcited, joyful, and sleeplessness. So as we know, the effect of coffea and the coffee, that is similar, we know. It wakes up a patient like for hours and more. So it has a similar effect here also as in adults. When we talk about Kali phosphoricum, it works on the nerves, we all know. So when there is mental fatigue, exam stress. So we always talk about, when we talk about phosphoric acid, when we talk about muriatic acid, we know that when the mental symptoms will be more prevalent than the physical symptoms, then we go towards the phosphoric group. So here also in Kali phos, we know that mental fatigue will be more like exam stress, because when we are talking about a child or an adolescent, we are more towards the work which is related to literary work is more. We can say that the work related to studies. So exam stress is one of the factors which can hamper the good sleep of a child. Next is chamomilla. We know that chamomilla is a child who is hyperactive. Chamomilla is a child who is irritable. And one word which we know, that capricious behavior is seen in chamomilla. So chamomilla and senna are the two remedies which comes at our mind the first time when we talk about a child and its sleep disorders. Then we know that if the child is irritable, if the child is healthy, has a fat, chubby body, teething related sleep losses, then that is related to chamomilla at first. Senna is another remedy, that is crying, worms related sleep disturbance. Worm remedy is senna, spigeria. These are some of these worm remedies. So the first remedy which comes in when we talk about the intestinal worms obstructing the sleep of a child, then we talk about senna. One more thing I would like to mention, that as per traditional belief, intestinal worms is one of the condition which is hampering a child's sleep. But in modern medicine, although there is not so much evidence as I've studied, it's not so much evidence, but I have seen throughout my research that if there will be irritability, itching around the anus of a child, there are some, like the child is having sleep-related disorder, anxiety-related disorder, and if the child is having poor appetite, irritability, all this combined, then one test, that is stool test, should be done and deworming should be applied. This may help the child. Next is phosphorus. Obviously, a fearful child, but a cheerful as well. Sensitive, wants to be carried always. Next is Calcarea carbonica. That is a Calcarea carb, which is fearful, sweaty-headed child. So when we talk about sweaty-headed child, then it's not just limited to Calcarea, but to Cilicia also. But here comes the difference. When we talk about Cilicia, yes, the head is sweaty, but overall the child looks dry. And when we come to Calcarea carb, the child is very healthy, fat, chubby, and Cilicia, the child is lean and thin. Nux vomica, overstimulation and irritability, definitely working on the nerves. Hypersensitiveness is there. Overstimulation, overexertion is also there. McCarb, that is sensitive and restless child, is the McCarb child, and the sourness also. Okay, here we talk about Melissa officinalis, that I told that in bruxism, Melissa and Phytoleca decandra have been two remedies which were proved to be very beneficial for sleep-related disorders, especially bruxism. So when we talk about Melissa, it is a remedy which is not given in so many books of homeopathic materia medica, but it is given in some, I would say, like in Robin Murphy's herbal materia medica also, that is Lotus materia medica, as far as I remember. It is given there, and in some other books also, where it is given in a few lines only. Its main therapeutics have been mentioned over there. So the main indications are calm nerves, and it is a mild sedative effective. It has a mild sedative effect. So when we talk about Melissa officinalis, it is a, I would like to say it is a lemon balm, and it belongs to the mint family. And it really works well when it comes to nervous system and when it comes to GIT. It works very well for both of the systems. Next is Phytolacca decandra. We all know that then when there is aggressive grinding and jaw tension, Phytolacca, it is very good. So most of us know more about Phytolacca as a remedy which is very good in breast cancers, a remedy which is very good in breast abscess, breast pain, and a lot more. But very few of us know that it is a very good remedy in bruxism, and it has been proved in the research papers as well through the clinical trials, through the randomized controlled trials. Next is obstructive sleep apnea. So the remedies which have been proved beneficial for OSA are lachesis, sambucus, ammonium carb, lamina minor, grindelia, opium. So among these remedies, two remedies I can say which all of us have prescribed a lot in our clinical practices. These two remedies are sambucus and lamina minor. So sambucus is the infant or child with nasal blockage, and lamina minor we are OSA with nasal polyps. We all have prescribed for nasal polyps. Lamina minor is the first remedy which comes to our mind. But when it comes to sambucus, then we have to see that yes, it is a remedy which we all think that it's related to the children and adolescents, but it helps very well in the people who are of adult age or old age as well. And one thing that is very good about sambucus, which we have to be taken care of, that is the patient or the child. If he or she says that I wake up with my head sweaty and so much sweat after waking up, I'm all bathed in sweat, then the first remedy which comes to my mind, I would say that is sambucus. Worms with a child having, or you can say OSA, in infants or children with nasal blockage, then the child is having some anxiety, or we can say the child is unable to sleep properly, and the child is bathed in all over the body. It's he or she is bathed in sweat when he or she wakes up. Then the first remedy which comes to the mind, that is sambucus. It's a very great remedy. When it comes to snoring, we have opium and other remedies also. But these are the remedies which I am telling you from the research articles which I have concluded. So these are some of the remedies. Next, adenoid hypertrophy. Here are the remedies. Okay, calcarea carb, phosphorus, all these remedies we know, pulsatilla, we know tuberculinum, cinna, agraphis, baryta carb, and all. So when we talk to adenoid hypertrophy, we know that there is swelling. So baryta carb is one of the remedy which I have personally seen has given very good results. And the other remedy, that is tuberculinum, where there are recurrent infections. And tuberculinum is one of the nosode which are proved very well in such conditions. So when we come to anxiety-related sleep disorders, aconite and arsenic are the remedies which comes to our mind. But not only these remedies, there are remedies related to the what kind of stress the patient is having. So when we talk about this, what comes to conclusion or what comes to the picture is the cause. The cause of anxiety is important to reach to the conclusion that which remedy will be prescribed to the child. Now the limitations and future directions. There is limited pediatric specific large scale clinical trials. As I mentioned, yes, there are limited clinical trials. Less effective in teething, croning, snoring cases. Yes. After reviewing all the articles, I have seen that homeopathy is very good in bruxism as compared to teething and chronic snoring cases in these two cases. Definitely, we know that in teething problems, homeopathy has a great results. But when it comes to bruxism, bruxism has much better results than teething. Need for standardized pediatric prescribing protocols, definitely. It has a potential in integrative pediatric sleep care. Yes. I would say that I have personally emailed also to the Indian Sleep Research Society. So being a member of German Sleep and European Sleep Research Society, they have asked me to contact to the Indian Sleep Research Society also, so that India could also be a part of the research which is going for melatonin and for other conditions which are related to melatonin. So I really want some of the homeopathic doctors should join. So I'm working hard on this because I want Indian medicine also to be one of the most effective. That is homeopathy I'm talking about. I want homeopathy to be proven to be more effective as compared to any other pathy for the conditions which we can cure definitely. So homeopathy shows promising effect for the pediatric sleep disorders treatment, especially bruxism and anxiety-related disturbances. It may help with ATH-related sleep issues, though the results for conditions like, as I said, snoring and teething are less, but the individualized treatment of homeopathy, it really offers a valuable alternative for any child who comes to us. Now, large-scale, high-quality trials definitely are needed to confirm its effectiveness and develop the treatment protocol. Future studies, definitely we will do more and more research as a homeopath also, and being a collaborative with other researchers also, we can do this. So these are the references, Bacha. Thank you.
Thank you, Dr. Kanchan Upreti. It's really a very good session. You really show the beauty of homeopathy and the research work you have undertook about the sleep disorders. And really, a person on the caliber of just passing and coming out from the college and making such a presentation is the one that shows that you are brilliant, and definitely you can become one of the legend of homeopathy if you go like this, because the knowledge and power and everything was there in your presentation. Actually, we need this kind of people who are fully dedicated to homeopathy when they join the courses in our institutions. And
Thank you so much. Thank you so much, sir.
definitely,
that's a pleasure to be here.
Yes, yes. We all like such people. This is what we are expecting from our doctors around the world also, because at homeopathy we can do a lot of things for different conditions. A homeopathy is supposed to be a multi-specialist, and he is whatever case come to him or her, it doesn't matter what is the case. But
Yes.
actually, the person inside, it is just a patient-oriented practice that is to be done in homeopathy. That's what we call as individualized case taking and individualized treatment. And at the same time, we call it there are doctors who are specific in their treatment. So it is also a system which is doctor specific also.
Yes.
That's why some people have different kind of thought. Even though Dr. Henman has shown how one need to take the case and how one need to interpret all these things. But in the later part, a different set of doctors came out here, and they have shown they have shared their experiences in a different way. And that's why we have a lot of schools like Dr. Shankaran School, Dr. Saigal School, Dr. Saptarishi School, like that. A lot of schools are coming, but what is it common is nothing but homeopathy. Everything was written by Hahnemann, but what the future generation, the present generation doctors are doing is they are giving more and more explanation to what Hahnemann has did some years ago, some 200 years back, 250 years back, we must say like that. Anyway.
Yes, exactly, sir. The principle is definitely the same. All we have to do is to carry forward the principle and the classic homeopathy, as I said.
Yes, that's the reason why some people say that homeopathy is a classical method, but it doesn't mean that it is pure homeopathy. It does not mean that there is a classical and Western type of homeopathy. But as we all know that we have a different set of presentations, different kind of treatment. Some people go with the pathological prescription. Some people go with the acute prescriptions. But common what they are doing is homeopathy. There is nothing. I am inviting Dr. Abhi Sharma to say a few words on your presentation. And Abhi Sharma is also an active participant of IFPH. And we need this kind of personalities in this forum. The
Good evening, sir.
Yes.
Good evening, sir. Happy Guru Purnima to everyone. And I was just listening to Dr. Kanchan's input on sleep disorder, and excellent presentation, Dr. Saab.
Thank you so much, sir.
Yeah. So what I actually would want to contribute in this is because I know a little bit of background in which Dr. Saab is working. She is very much into the sleep related troubles and all, and for that I think there is a reason for that. So basically, when we actually go through the literature and the surveys that are happening in Europe, specifically when we actually talk about Europe, there's a saying in Hindi that दूर के ढोल सुहाने होते हैं. So the thing is that when we talk about Europe specifically, I have actually seen that all of the troubles, if not more, if not all, most of the troubles are related to mental ailments. Switzerland being the epitome of depression. I was it was staggering for me to find that the studies that have actually been done, we find that 70% of Swiss population is under depression, and of them, one out of three Swiss person is suffering from sleep deprivation. They cannot just sleep, and I actually saw the amount of the money that is being spent on the Swiss population is 6.5 to 7 billion dollars every year just for depression and sleep related disorders. It's a huge chunk of money, and I think that see, it is always good to say that okay, homeopathy is being done for the betterment of people and everyone. But being apna coming from a clinical background, I do mean to say one thing, that if in case it is not about money, then we won't be able to survive. And it's a huge chunk of money, and being homeopath, I am actually ready to pounce on it any day. So I just would want to ask Dr. Kanchan, because she has actually been to these places and she has actually met few of really leading homeopathic doctors. What have you found, and how can we actually practice there?
Okay, sir. You're talking about how we can practice in European countries, right?
No. I'm just saying that how can we actually get into this this area, and we can actually give them homeopathic medicines, which as per Swiss franc is very, very expensive when we are comparing it to Indian rupee. So it would be cheapest for these Swiss people. And how can we actually get into it? How can we actually break this market?
Okay, so I didn't get you. How can we break this market in India, you
Yeah.
mean, right? How can we
Yeah.
how can we
Yeah,
gain the patients from
I'm not,
Switzerland?
see, basically I'm talking about myself. I'm a audience over here. I just want to know one thing, that me practicing over here, how can I actually give my medicines to these people?
Sir, actually, I would like to mention one thing, that yes, first of all, I would like to say that he is the person behind my success. Definitely, he is the one who has always pushed me to work hard and hard, and he has shown me the right path always. So he is my guru, and sir, happy Guru Purnima to you again, once again. So
Speak about,
to all,
speak with
definitely
your-
to all, and yes. I would like to say that definitely I have been to these conferences and I was the only homeopathic physician over there. So I have made sure that they should get indulged into the beauty of homeopathy. And it has really done so well that when I'm in touch with some of the doctors from there who are very interested in knowing how homeopathy works, and they really want to collaborate with us. They really want to collaborate with us, and also they have advised me, they are the one who have advised me to please talk to the Indian Sleep Research Society, and ask them that since 2019 there has been no publication by the society. It is not active since 6 years, so it is really needed that we should talk to them and we should ask them to reactivate and just restart everything, because they really want our cooperation as well, our ideas as well. So in fact, I have started connecting with the Indian Society, Sleep Society, and I really want to start this because I want to include India as one of the countries. Like, I've been in a conference, been to a conference which was of Austria, Switzerland, and Germany, but India was not there. I had a question over there that you have selected me, you have invited me here, but why only a person from India? Why it's not for India as a country? They said that Indian society is not active, so why don't you take an initiative to ask them to be active in this field again, when they sleep this, so that they are in fact working on something and they want the inputs from India as well, so that we can also be the co-authors of the research papers, but or the authors of the research paper definitely, but only by working something about that only.
So,
We can
so basically the thing is that we know that the Indians are like really good at resting. So you want to say that the Sleep Society of India is sleeping.
Yeah, exactly.
And it is right time for homeopaths like us to pounce on this opportunity and take over the Sleep Society. That is what you want to say, Dr. Saab?
Yes, sir, definitely. It's an opportunity that it's not our fault. It's just a opportunity for us that if
And
they are sleeping, then why not?
Yeah.
and one thing more, when we are talking about sleep related disorders, specifically when we are talking about sleep related disorders in pediatrics, in children, like this laptop, mobile, and iPads are like the biggest culprit. And
Yes.
specifically,
Exactly.
if in case we're talking about India, the tier 1 cities are actually getting affected the most. Delhi, Mumbai, Chennai, and all these like Kolkata and these tier 1 cities, these are like, and even tier 3. I won't actually just like stop at tier 1, tier 2, tier 3 cities are also getting affected. And it is high time that we talk about normalizing the sleep related disorder. Like Dr. Saab said in the beginning, these sleep related disorders, they are actually not being talked about. Today itself, I saw a patient, a child, 9-year-old child. He does not want to sleep. He does not want to sleep, even if they actually like close the lights and everything. He will stay awake till 1:30, and he'll get up at 6:30. And
Yes.
I asked this to the parents, that what are you doing? Why? Where's the discipline in the in your home? The kid is just having like 5 or 6 hours of sleep. This is not sufficient for this kid. And now you tell that the child is always irritated and all these things. So, like Dr. Saab said, melatonin and dopamine. If in case there is decrease of these two hormones in your body, obviously there will be effects on your body language, your behavior, your everything. So it is high time. And it was like it was quite insightful. There were few medicines that I didn't use, and I actually got to know about few. I would definitely be using them. Apart from all this, Dr. Saab, how can how more can we actually like apna, when we are talking about sleep related disorders in children, what else can be done? What else can be done with it?
Yes,
See, I'll yeah,
definitely
see,
that's a
I
big
just want
question.
to, pardon, sir.
Yes, that's definitely a big question because we have medicine, but the medicines not alone can do these things. Of course, we need to educate the parents in such
Yes,
a way
yes.
so that they will have to give what the child really want, what kind of control they need to, not such a strict parental control, but instead they have to change their habit first. Then
Yes,
only, then
exactly.
only, then
Yes,
only the
yes,
child.
sir. Yeah,
Other,
yes, that's why one more thing I would like to mention, that before going to this conference, I also had not heard about this in India. That yes, I had this knowledge, but never heard it from anyone, any doctors or any parents, that breastfeeding at night is more effective than breastfeeding at day or morning. So I think that education or counseling to the parents is very important, and if they are educated or if they are counseled about all these things, if they are aware about these things, then it can be very helpful to the doctors as well, because prescribing medicine alone could not be that much helpful as the other factors as well. Like in other conditions, we ask the patient for the lifestyle change, the dietary modifications, and a lot more other things. So similar to that, there are some modifications which are very much needed for the parents as well to adopt. So these are some. And one more thing is the communication, which is very important to align with the circumstances that the children have faced the consequences. So communication is very important with the children.
One,
That also is a very important thing, and I would like to add one more point that nowadays people used to have supper very late. They used to take the supper, and as a result, they are not getting sleep. All of a sudden, soon after taking the supper, they just go for bedtime. But unfortunately, they are not able to sleep properly, and as a result, they may restart watching videos and everything again and again, and that will spoil the night, and
I
family get into collision thereafter.
I actually would want to add one more thing, sir. This actually gets like neglected and overlooked upon. If in case when we actually wake up in the morning and we used to go to our assembly classes, so we used to sing different prayers. Some might be in like some local language, Hindi, English, whatever. But you always get one thing that is always common. If in case any poem, like whisper a prayer in the morning, whisper a prayer at noon, whisper a prayer in the evening. So the tone of this thing, the prayer, is itself in a very high pitch. It actually makes you wake up. It actually like up now, it works in a way that a person wakes up and he is actually indulged in doing activities. And when we talk about these night rhymes, twinkle twinkle little star, how I wonder what you are, this is a very soft poem. You actually, when you actually speak this, the voice, the decibel is actually very low. And we are actually talking about, specifically when we are talking about the sleep disorders in children per se, you will need to keep this thing in mind. Do not let the child, see, come over here, see, she's my daughter and she's as of now she's very active, but I will make sure that before she sleeps, okay, you can go. I'll make sure that before she sleeps, she will be read 2 or 3 stories that will slow down the pace of her mental activity so that she sleeps peacefully.
Exactly. That's what really needed, and that's what the parents need to do. Unfortunately, nowadays, what happens is that parents put the patient their babies to study more and more at time. They press the you need to become the first in the class, or so you have to study little more than that. So instead, they forget about this storytelling, singing, and everything. That's a big challenge to the future generation. And as homeopaths can do a lot of things with our homeopathic medicine, and our case taking itself will reveal what is the cause behind the problem and why the child is not sleeping, and why the child is sleeping very late, why the child is waking up very late, and how it can be corrected. And there are medicines as well. As we all know that the person child always likes to sleep very late in the night, and they wake up very late in the morning also. So they will have to suffer a lot because of that in the school. They may have to skip the breakfast in the morning, and they have to rush into the class quickly. And because of that, they may have to cry before the parents, and in the morning itself, they may start crying, weeping for everything, for bathing. They even though they want to bath, but they don't have time to bath, so they have to rush into the school. So they have to weep every time. So this is how a typical Pulsarla baby is born. Am I right?
Yes, sir, exactly. Dr. Kanchan, one more thing. I would actually want to add one more thing, like Dr. Danesh was saying, that the medicines, they come later.
Yes.
First is the counseling. First is talking to the patient. First is knowing where the problem is lying. Always and always work on this thing. We actually learn this in organ of medicine about the maintaining cause.
Yes, sir.
When we are talking about patients and children specifically, You'll need to become a child and take the case and ask them what is the problem, and they will tell you, Mama Papa doesn't sleep on time. Mama Papa are always on tablets and laptops. They actually come very late. We are having our dinner very late. How can I sleep? So then
Yes.
the child does not need the medicine. It is the proper scolding and counseling the parents need from a doctor. And when see clinical point of view, you're actually charging money for this counseling, right? So you actually, they know what they're supposed to do, but
Yes.
they actually would want to hear it from you in a very firm and affirmative voice. This needs to be done, or else this is the thing that you're looking at. After 10-15 years, don't say that the child has become so irritated and peevish, out of the hand, and all the rubrics that we hear, not
Yes.
timid, peevish,
Yes.
childish, cross, whatever. He's not sleeping on time. It is because of your fault. And that is how you actually like proceed with any case. Let it be anything, but in this case, and once again, if in case you would want to add something, Kanchan.
No, sir, definitely. I've
Yes,
like
yes, Dr. Kanchan. Actually, the International Forum for Promoting for Homeopathy is with you, and we can definitely get a big wake up to this sleep society so that we can
Yes.
build it in a
yes.
big way, and we can make it a grand success, because there are a lot of doctors presented different papers on these sleep disorders with the homeopathy in this forum, so we can connect them and we can make them back to this big world of sleep, and how the society can build, and how we can manage the people who are suffer from, because we can definitely say that the future generation is in a big threat because they may have proper sleep, and so we need to concentrate more on that area, and we can build up slowly with our homeopathic concept, and definitely conquer the world with homeopathy. This is what I would like to add to, and this is what we have to say to you also, because you at this younger age of just how many years of experience, doctor? Just
She just passed, sir.
yes,
She
yes,
she's just passed.
yes, I know. That's why.
Yeah.
That's why I'm telling that a person on the caliber of just coming here from the college and presenting such big purpose is something great. No, but that's why she got the gold medal. We really loves your gold medal uh, very much, because we just like
Thank you,
P.T.
sir.
Usha got a medal in the Olympics. Just like that, we really loves your achievement. Your achievement is not simply an achievement. You just building upon that to make sure that homeopathy will be safe in your head, and not only in the future generation. That's the purpose of the International Forum for Promoting Homeopathy, because we want to promote homeopathy to everywhere. That's why you told that at Switzerland there are 70% of people are suffering from this sleep dyspnea, sleep problem. So we not only this is going to be a big opportunity for us. So we will have to make things possible. We will have to educate our doctors to come back to this world of sleeplessness, and take it as a big business, we can say in that way, because it's an opportunity for us. Take you to use this opportunity. This is what I would like to add. And our button, Paresh sir, want to say a few words to you. Yes, sir. Please unmute, sir. Please unmute.
Thank you, Dhanesh ji, and everyone. Namaskar or congratulations, Dr. Kanchan Upreti. Very good explanation. Sleep disorder in children. So main cause sleep disorder in children, fear and anxiety, emotional trauma, main cause. Another cause in this time, watching TV, using mobile, before bed, children other call. So many kinds of remedy and disorder of digestive trouble. Digestive trouble in children like worms, etc. So belladonna is the best medicine fear. Child fear suffering, sleep disorder, belladonna is a very good remedy. And calcarea car, astumonium, hyoscyamus, many kinds of medicine. So very thanks, Dr. Kanchan. Excellent session. Thank you.
Now I
Thanks, sir.
invite,
Thank you.
now I invite Dr. Manoj to say vote of thanks to the session. Dr. Manoj. Our president, Dr. Ismail Said sir, is here. Sir, can you speak for a while, sir? Sir, please unmute.
Yeah,
Yes, sir.
totally today I am very sick.
Okay, sir.
You heard about my lumbar fracture, no?
Okay,
So
sir.
today I got some other meeting also in the hospital,
Okay, sir.
and I looked after a minimum say 20 to 30% I will consult today after 12 o'clock. After that I am very weak, and I get up in the hospital in the there for up to 5 o'clock. Then I came back. Anyway, I'm attending the last portion. Very interesting portions also you are telling everyone. Very important to the child care and family care. You know, the care of a child is the care of family also. How to behave with to children, how to manage them. Everything is told within the very clear. I'm very happy to hear that. No comments further to us. Anyway, I will speak. Okay. Thank you.
Thank you, sir, for coming over here and watching the presentation. I'm very happy to say that Dr. Kanchan Upreti has done a beautiful session in this evening to us, and active participation from Dr. Avi Sharma, her mentor, and really we appreciate. We are very happy to say that you both are building homeopathy in a good way. Congratulations to both of you for such sessions. And with that, we come to end of the day, 1774. Thank you all.
Thank you, sir.
Thank you. Wow.
Thank you all. Tomorrow we will have a session from Dr. Dhaniga Dhagat, and Doctor will be talking about clinical applications of nerve repertory. So hope all of you will be joining us tomorrow at the same time. Over to Dr. Mariamma John.